I want to talk to you today about earwax and the issues concerned. So, earwax is formed in the outer part of the ear canal. In the majority of the people, there is no issue. The wax migrates by itself and comes out, does not cause any problems. But in a minority of patients in the population, about 20 to 30%, there is dry wax formation. Dry wax can lead to irritation, to pain, can lead to infections and sometimes even hearing loss. Now, one should not use hairpins, earbuds, hair grips, and even using the little finger to clear the earwax or ear canal, because this can go into the deep part of the ear canal, which is the bony part, and cause serious infections and even hearing loss. We have sometimes seen patients who have come with a perforation of the eardrum because of use of earbuds. So when there is dry wax formation, it would be advisable to use some form of wax dissolving eardrops or even simple olive oil. And if this does not clear the problem, you will need to come to an ENT doctor who will clean it by a suction clearance under either the microscope or an endoscope. So remember, when there is a problem of dry wax, you definitely need to consult an ENT surgeon how to proceed further. It is very important to take care of your ears for the rest of your life and hence your hearing. So please include this as a part of your annual master health check. Thank you.